Thank you for this invitation to talk at this meeting. I'm going to be talking about how things will change due to COVID-19 from a community perspective. A couple of things to mention first. Some of this data has been presented previously at a meeting HIV Glasgow at the end of last year. And secondly, just to say about the European AIDS Treatment Group, which is a patient-led NGO advocating for the rights and interests of people living with or affected by HIV and AIDS and related co-infections within the WHO European region. I'm going to be talking about three things during this presentation. Firstly, I'm going to give some background information about the impact of COVID-19 on communities affected by HIV, and this is based on data that EATG gathered during 2020. I'll be talking about prevention aspects, care, and some lived experiences. I'm going to talk about what changes we must see based on what we've learned about COVID-19 and the impact on communities during 2020 and what we would like to see in the future. And thirdly, just some final words: different virus, same script. Data was collected by EATG during 2020, and we published 6 bulletins during the year, one very early this year. And this data was based on surveys, a review. We did some interviews with stakeholders and members of the HIV community, and we held an expert webinar and also finally closed with a survey. So EATG's data is quite rich and varied, and also it matches some of the other data collected by other organisations in the European region, and it's altogether does provide a very useful insight into what was going on during the year and the impact on communities affected by HIV. So first, I want to talk about some of the impact on prevention, and this includes HIV, TB, hepatitis, other STI testing, and PrEP delivery. What we saw was some very serious challenges, for example, to testing. This was disrupted quite significantly, and some of our respondents talked about there have been difficulties accessing testing, and some reported, 50% reported that there was STI testing was only available during emergencies. And this was quite significant across the whole region. There was also a reduction in demand for testing, although one country, Ukraine, reported an increase in demand for testing, but overall there was a reduction in demand for testing, partly because of difficulties travelling, but also because people were unwilling to go into clinical centres or testing sites because of a fear they might catch COVID-19. There's also problems accessing PrEP. In countries where PrEP had only been reintroduced recently, it was cancelled completely. In other countries, PrEP was available only in limited supply, and therefore there was quite a significant effect on how PrEP was delivered across the region. Linkage to care. This is something which probably was affected, although data is still emerging even now about how serious this has been. Certainly with access to treatments, which I'll talk about on the next slide, access to treatments was jeopardized in some ways and therefore led to the need for creative solutions to making sure people could still access HIV treatments. But we do need further data to see how much this was affected. Some of the solutions that came up in response to this was there was an increase in community facilitated self-testing. And this diagram here is from one of the sample questions, example questions from the second bulletin. Do you have information regarding access to self-tests? And you can see here some of the respondents talked about getting self-tests from NGOs, some from online purchase, some from pharmacies, but also some respondents said they never had access to self-testing, which is interesting in itself. And therefore the increase in self-testing during 2020, we believe, is one of the significant benefits of some of the responses to the crisis during the year. There's also promoting testing, and quite a few organisations promoted testing to remind people they need to be tested regularly, such as Facebook campaigns. There was an increase in emergency appointments to make sure that people could get appointments for testing. So while usual access to testing was jeopardised, people were able to make emergency appointments, and this was seen as quite a significant response, which did help sometimes bridge the gap between the need for testing and actually having access. There were innovative delivery solutions, so people were posted kits to their homes, testing kits, and also, as we'll see in a couple of other slides, we'll see that there are other things delivered to the home. And therefore, what we did see here, and also in the other in the other areas of responses, there were innovative solutions to some of the challenges that were occurring during 2020. Talking about impact on care, and this includes HIV care and treatment and access to medicines. Well, there was a lot of disruption in appointments. Some respondents reported that 48% of appointments were postponed, and one member from Greece said that he was left with practically no doctor to follow up. There's also significant psychosocial impact, and I think many people have noted, many organizations have noted the impact on mental health because of fear, loneliness, and travel restrictions. And of course, the question, is there a risk of PTSD following the crisis phase of COVID-19, and something which must be tracked in the future? We did see some evidence of medicine shortages and advice in some countries to switch treatments. And also there was a threat to treatment supply. And in Kazakhstan, Switzerland and Russia, there seemed to be procurement problems, and also issues around physically moving medicines between countries because of control restrictions to control COVID-19. So that did affect some aspects of the treatment supply. And also there's problems with treatment delivery, so getting medication to those who needed it, because either they couldn't physically get into a place that dispensed treatments, or they couldn't get appointments to manage their treatments protocols. Some of the solutions that come up to address these challenges, well, there were serious attempts to maintain treatment continuity, and of course one of the obvious ways to do this is by extending prescriptions, and this was done quite extensively, which what we saw as a significant benefit to address the problem. And also alternative ways of accessing treatments for people who physically couldn't get out. So we had reports of people delivering treatments, of clinics delivering treatments to the homes of people, treatment for HIV, but also OST for people in harm reduction programs as well. So getting the treatment out to the people was quite creative in some of the solutions that were coming up from the community. There's also a big increase in e-health, telemedicine, mHealth, and this is worthy of a whole different presentation, because there are great things about mHealth, but also there are quite serious challenges about mHealth. But certainly this was one of the short-term solutions that came up during 2020, which did address some of the big problems involving HIV care. There were big pushes by some organizations to increase funds through fundraising and negotiating with donors for flexibility. Most donors were quite flexible about their funding during 2020, which is a positive thing. But in the long term, the fact that COVID-19 is going to be running alongside HIV for a long time in the future is going to have some impact on how organizations apply for funding and their work plans. There was also a lot of monitoring of shortages, because COVID exposed previously unknown access issues, and therefore there was more monitoring to see where the shortage of treatments were, and to try and address these shortages. And also there was a lot of advocacy and communications, and in some countries there was direct negotiations with pharma to increase the treatment supply, particularly in Bulgaria, Italy and Czechia. Another impact on care affected comorbidities, and some of the challenges were there was the predominance of COVID-19 above all other pathologies. And I think this affected a lot of disease domains, but it is certainly something to note here. There was a significant impact on mental health, so people with pre-existing mental health problems faced increased challenges to their mental health. There were difficulties delivering person-centered care simply because COVID-19 was dominating the narrative, it was dominating clinical services and also other types of support services. There was enormous power of communities evident during 2020, and they helped bridge the gap in the provision of care and support, but also the big question, is this sustainable in the long term? And also there are problems with over-reliance on centralized services. So for example, if people lived away from a capital hub, they found it difficult getting access to services for their comorbidities aside of HIV. The recommended solutions that came out of this were there should be better, more equitable and improved methods of communication. The pandemic amplified the emphasis on telemedicine or mHealth, but in the long term, how is this going to be equitable, and how are more people going to get access to it fairly? At what point do we transition from emergency to strategic response? This is something which is going to be a big question over the coming years, because as different countries go through crisis, post-crisis phases, at what point do we start planning for the long term? And at what point are we still engaging in an emergency response? There should be sufficient focus on non-COVID pathologies, so communities are going to have to advocate to make sure that COVID doesn't dominate the narrative in the long term, and also explore further integration of services, but also avoid the danger of an over-reliance on centralization. So while integration is good, there should still be a notion of decentralization, if that makes sense, so people away from a capital hub can get access to treatment and supply. The lived experiences of people affected by HIV during COVID are summarised on this slide. We can see that many felt there's a lack of effective communication by decision makers when big decisions were made to control COVID-19. There's a real need for increased public participation in health decision making, because this was evidently not the case during 2020. There needs to be more community empowerment and participation in policy making and programming. And we also saw that COVID-19 exacerbated existing vulnerabilities in different countries with different populations, but including the homeless, people facing difficulties at home, and also migrant communities. And gender-based violence was also on the rise during 2020. The recommended solutions: there needs to be trust between the patients and care services. A long view is required because COVID-19 will be a feature of our social landscape for some time, so planning should acknowledge this. And funding is going to be a big area of concern for community-based organisations, and as well as increased stress and anxiety. The HIV space is being squeezed, so we must make sure the voice of people affected by HIV is loud, front and centre in the coming months and years. So what changes should we see based on this data? Well, firstly, we should see mental health as a priority area of support. We should see increased availability of self-testing, because that did prove beneficial in 2020. So removing regulatory barriers will speed up access. Amid the noise of COVID-19, communities need to increase advocacy to ensure decision makers don't lose sight of other pathologies such as HIV, TB, and viral hepatitis. The community response to COVID-19 did bridge some of the more serious gaps in health and support provision, and therefore communities should be empowered and should explore ways to make some of these beneficial interventions sustainable. And the community should be involved in redesigning HIV service delivery models, because these will be changed post-crisis. They will have to change as COVID-19 and HIV coexist into the future. Some other things we must see based on the data: we should promote innovation, availability and uptake of e-health, but this should be equitable. And also there are big issues around privacy when it comes to telemedicine and e-health. So how can this be addressed in future policies and strategies? We should advocate for universal access to prevention and care, making sure no one is left behind, whichever group they may belong to. We should explore further integration of services, especially around comorbidities, but beware the dangers of centralization, which is what I've mentioned already. We can use COVID-19 as leverage to increase support for initiatives such as one-stop shop, community centres, universal health access, and the fight against stigma. So COVID-19 can be used as leverage because people are now so much more aware of how a disease can impact on communities and be divisive, and also expose needs of certain people within those communities. And planning for the future: there will be no post-COVID time, but there will hopefully be eventually a post-crisis time. So communities need to plan strategically for the coexistence of COVID-19 and HIV. So final words: different virus, same script is actually lifted from a Lancet article which talks about how the way that HIV caused problems within communities, it was stigmatized, there were marginalized populations associated with HIV, has also been appearing in the cases of COVID-19 as well. So COVID has exposed significant inequalities, much like HIV over the past decades. So marginalized communities are now disproportionately burdened by two concurrent pandemics, HIV and COVID-19. There are some unexpected positive outcomes from COVID-19 during 2020, which we can capitalise on, for example, self-testing, OST and ART HIV treatments at home, and video observed therapy for TB. Advocacy for coronavirus vaccines access is a priority because this is going to have to be given equally throughout populations, not just for those who are most privileged. And organisations such as Frontline AIDS are leading on the provision and advocating for a people's vaccine, making sure no population is left behind. And finally, the emergence agency of community organisations has been really evident. They've been more assertive, they've been networking and partnering in much more effective ways. Their support has been more strategized and focused. And one of the things they're going to have to focus on now is to try and gain lost ground during 2020 on the fight against HIV. So I think communities are going to be very influential in the future. Thank you so much for listening to this presentation, and I look forward to questions in the Q&A.